on the agenda is to approve the minutes of the last meeting, and do I have a motion? Motion from Ms. Hickerson. Do I have a second? Ms. Boney and Ms. Harvey. But did anyone have any corrections or additions? If not, then all of you in favor of that, please say aye. Any opposed? Okay, thank you. Now, Mrs. Stinson, you may tell us about our financial condition with our funds.
Sir. Beginning with Fund 264, our per employee per month for the self-funded claims experience ended in October at $847 compared to prior year of $746 for a year-to-date in this category of $895 compared to $835 prior. When we add the on-site clinics, our per employee per month increases to $891 compared to prior year of $785, with a year-to-date average of $925 compared to prior of $869. We just recently completed open enrollment, and I'd like to share with you as part of the 264 presentation today what we saw in terms of shift in enrollment as part of the open enrollment period. Within the deductible plan, we saw a decline in enrollment for 2015 of 11.58%. For the HRA plan for 2015, we saw an increase in participation of 15.91%, and we saw a 2.55% change for the copay plan for 2015. What this says to me is that people are being more proactive in reviewing their plan options, understanding the cost, understanding the benefits of the plan, and what best suits them and their family. So I was very happy to see the shift in the enrollment numbers. So that's what we want to develop as a consumerism-based program. Moving into Fund 266. For the month of October, we ended at $243,510 compared to prior year of $162,280.
Do you have any questions of the financial reports? Okay. We don't need a motion. Okay, no further action then is necessary on that. Next, we'll have a wellness update from Ms. Kelly Perrion. Is that correct?
It should be sir. It should be Mr. Good coming up next.
Oh, Ms. Kelly, I'm just I'm ahead of myself here then. Workers' comp and OJI. Agenda item number 3. My apologies.
Good afternoon. I'd like to report that in the month of October, we completed the month with 9 work-related injuries. As you look at your report, you can see where and how those break out. That brings the total to the year to 181 injuries. Of those 81, 98 are OSHA recordable, 63 had restrictive days, 21 had lost time days, and 14 were all others. The dollars incurred for those 9 injuries were $6,250. And as you look at your next page there and you look at the graph, you can see that in 2012, at the end of October, we had 175 injuries. In 2013, we had 156 injuries, and in 2014, we're at 181. So you can see how that pretty much flows along with that. With the number of people we have and the hours, you can also tell that we're doing pretty good. Just to kind of let you know, in 2012, the county actually had 9,661,000 hours worked in 2012. In 2013, we had 10,022,000, which was an increase of 3.73 hours worked. And so when you look at the increase of the hours worked and the slight increase of the injuries, you'll see that probably pretty much going, and that's probably because of the school system, the addition of the new school. The Board of Education had 8 injuries, and the dollars incurred for those 8 were $5,650, and the county general had the other one for $600, as total incurred. That one injury for the county was in the Animal Services, or PAWS. On the last page of your report, you'll see where it talks about the total incurred dollars. In 2012 at this time, we were at $532,000. In 2013, we're at $247,000, and this year we're at $276,000. And again, that's where you recall with the increase in personnel. That's a pretty good rate of return there as far as the safety. So, any questions?
Any questions or comments? All right, thank you, Mr. Good.
Thank you.
Now, the eagerly anticipated report on wellness from Ms. Perrion.
So, for September and October, we went to Wellness on Wheels, where we go to the specific schools and departments to do some promotion on MedPoint clinics and Smart Steps wellness programs. In September, we went to 9 schools. The total staff amount of the departments and schools we went to was 786. We saw 242 of those people at our tables, or 31% participation. For October, we had 52% participation. We went to the EMS departments, Central Magnet and Laverne Lake, in October. For September, October, wellness coaching, individual coaching at Blackman MedPoint Clinic, there were 9 active patients with 27 appointments for those 2 months. The wellness fair was on the 17th of October. We had a tally counter attendance of 680 people in attendance. And the individual screenings that we had are listed, so you can see we gave 382 flu shots, 17 mammograms, 89 hearing screenings, 70 sleep screenings, etc. You can see those. We had 96 employees do 5 or more screenings. The current and upcoming activities for November: we are doing the Zensi Health Risk Assessment online until the 30th of November, so we have a few days left to participate in that. The Wellness on Wheels is still continuing throughout this year. The Life Services webinar is Eating Your Way to Wellness, and Maintain Don't Gain is a weight management program that is available through the MedPoint Clinic starting on the 24th.
If I could add one thing to Ms. Perrin's report. I received a call from the management team of our MedPoint clinics today. We did give out 382 shots at the health fair. However, we've had many people who have continued to take advantage of the flu shots offered through our clinics. The request I received this morning was to do an additional purchase of 100 flu shots, which will put us at 1,500 flu shots if all of those are given within the clinic. So we've given quite a few flu shots over the last 2 months in our clinics, and either through the fair or through walk-in or appointments at our clinics.
Okay, anything else, Ms. Perrion, or anyone have any questions of her? Okay,
Thank you.
Now, the next agenda item is an annual report from Cigna. And who's giving us this?
Mr. Paul Huffman from Cigna will be joining us to give this report.
Mr. Huffman.
Good afternoon. Does everyone have a 6-page handout in front of them? I'll go through that real quickly. Last week we conducted a full, thorough review of the last 12 months of claims, July through July, with Ms. Street. We went through about an hour and a half on medical, another hour on pharmacy, another 30 minutes on dental. So it's a pretty extensive review that we're going to condense down to 6 pages that I'll go through and kind of hit the highlights. If you look at the cover page, what we like to do is look at a review a year over year. and we base this on your fiscal year, July 1st to July 1st, incurral dates. So we look at the claims that came through during those 12 months compared to the previous year from the same dates. Anytime you see the word norm or normative in this report, that's our Cigna Book of Business, and for a municipal public sector. So these are your peers throughout the nation that we have on the Cigna Book of Business that we're comparing you to. Okay. One thing to note as we go through, if we're looking at the current period, that's the period 7/1/13 through 7/1/14. Keep in mind as you look at that we had some pretty significant plan changes that you made on January 1st, right in the middle of that period. So you're starting to see some of the impact of those plan changes, and yet not all the impact. So we're still going to get some of that from our next year's report, but I'll highlight what we think we might be seeing from those changes. Turning to page 2, this is your medical snapshot. So for 12 months, looking at the current period over the base period, we did see a slight growth in the number of employees and the number of members. That's all dependents added to the employees. That's in the top left section there. The total number of members increased almost 5% year over year, so you had some good growth. As you move down the page, the total payments at the bottom left in red, Rutherford County paid out about $5 million more in medical benefits, which was about a 17.8% increase in medical payments year over year. Some of that obviously was due to having a larger group, but in the top right, you'll see that trend year over year was about 11.2%. So the medical cost of the services went up about 11.2%. The next line under there takes out those individuals if we remove anyone that had claims over $100,000. So we call those catastrophic claims, big claims. If we take those out of the picture for the base period and the current period, your per member trend is only 3.4% year over year. So that was a big factor that played into the utilization during this most recent year, was that you had an increase in some of your catastrophic claimants that were over 100,000. Moving down the right side of the page into the outpatient trends, one thing we want to point out is your emergency room visits per 1,000 members. If you'll recall, on January 1, you put in a higher copay for emergency rooms because we saw last year some poor utilization from emergency room usage. We might already start to see some improvement there. As you can see, we had a 0.1% decrease year over year, relatively flat. So we are assuming that $300 copay on a couple of the plans is making a difference, making people think about where they're going to get their treatment, looking for alternatives either at urgent care centers, MedPoint clinics and things like that.
At the time that we made that change, we had about a 33% steerable claim activity, meaning that 33% of the claims that were presenting themselves at the emergency room could have been treated at a lower level of care. And so when he talks about poor experience, he means the decision-making process to receive care at the appropriate level. And we are now seeing a response to the plan change that was made.
I just want to clarify, you mean lower level of care. You're not meaning they would have gotten less
Right.
care, but a less expensive care, right?
Right, there was another opportunity for care to be received at the same level through a cheaper option. Thank you.
More appropriate care. How about that? And right underneath the red, you can see, and the reason you want to focus on emergency room visits is look at the average cost of a visit. I mean, it's $1,100 compared to an office visit, which is usually $130, $150. Even urgent care is only typically around $150. So we want that to be used strictly for emergencies where they can't receive care anywhere else. Page 3. I want to highlight just some of the demographic changes on this page. This gives you an overview of the age bands of your employee and member population and how that compares year over year. There was pretty much a consistent age band from each year to year. However, we did see an increase over on the right side among the members age 60 to 64 and 65 plus. In the members that included the catastrophic. So what that tells us is some of the members that we saw those large $100,000 claims were those members that were over the age of 60, and we did see that. Because when we remove those, the information stays relatively constant. Another thing to highlight down at the bottom right is we look at an average spend by relationship. So based on the employee cost average, the spouse average, and the dependent average. And if you'll recall last year, we identified the spouses as having relatively the same cost, as you can see under the base period, about $4,000 per individual. But we saw about a 22% increase in the spouse average over the previous year, whereas the employee was very close to what we saw on the plan, which is closer to that 8% that we would expect. Dependents, now these are going to be your children dependents, anything other than a spouse, also saw a pretty significant increase in average claims, going from 1,800 to over 2,000 per individual.
Does that include catastrophic, or was catastrophic removed from that?
In this one, the catastrophics are included. Yeah. I removed the other section. Okay, page 4. This is a quick look at the catastrophic. I've already mentioned this, but last year, in the base year, you had a pretty good year. You had lower claimants over 100,000. In the current period now, you're getting closer to for every 1,000 people you have on the plan, about 4 of those are going to hit over 100,000. And the interesting thing is that's normal. That's what our book of business sees, but it's higher than you were last year. And it was increased. It was up from 14% last year to 20% this year. So it made an impact in that current period. Okay, then that's basic review of the medical. I'll jump to page 5, which is the pharmacy. And to point out here, the pharmacy ran relatively well according to our expectations. The first red box that you see highlighted is what we would term as your pharmacy trend. Your ingredient cost of a prescription year over year went up 6.5%. That's actually a little less than what we see on our book of business, so that's not shocking. The next thing down is the cost share as a percent of ingredient cost. I highlight that to point out last year your members paid out of their pocket about 16% of the total cost of a prescription. So when they pay a copay or they pay a coinsurance on the HRA plan, they were picking up about 16%. And that's relatively close to what our book of business is, which is about 15%. But what we don't like to see is that your ingredient cost went up, but the member cost stayed relatively flat. So as a percentage, that went down. They're picking up less cost. And I think that has to do a lot with more and more people enrolling into the copay plan and having copays for pharmacies, because when they stay flat and the cost goes up, you have to be aware of that and look at that each year to see if it's time to make the copays move at the same inflation rate. Okay, so just to let you know, they paid as a lesser percentage of the total cost in the current period. A good thing to point out, the third red square coming down, is your generic utilization rate. With a lot of the brand name drugs coming off patent, going to generics, a lot of your people got switched over from year to year, and you're up to close to 84% of the prescriptions being generically filled, which is even above our normative. So a very good push there. A lot of what you're doing with the zero-cost generic preventives is helping drive that, and every percentage that you gain is a significant savings to your cost. Underneath that is your mail order fill rate. We were a little disappointed in this because, as you recall, you did improve your mail order cost share on January 1st. On the copay plan, we brought the mail order copays down a little bit. And on the coinsurance, on the deductible and HRA plans, we made the mail order piece a little less than what it is at retail. But they can still get it 90 days at retail. So we're trying to drive some incentives so people get their maintenance medications through the mail. It drives a higher discount that the county pays. Also helps with compliance. So people that receive their drugs through the mail tend to take them more and complete their prescriptions. But as you can see, the fill rate actually stayed relatively flat, so that's something that we probably want to focus and we talked about. All right, and then final at the bottom of the middle of the page is specialty pharmacy. This is probably our biggest focus in the industry is specialty pharmacy, those drugs that cost $500 or more per prescription. A lot of them do not have generics available. They're biotech drugs for severe chronic disease, multiple sclerosis, things of that nature. The Humiras, the Enbrels that you see on television, they're very expensive drugs. And then we also have all of our clients are experiencing a large increase in this due to new drugs coming out for hepatitis C. Drugs that cost $84,000 for a full regimen to prevent maybe a future liver transplant, which could be $300,000. So it's a cost savings in the long run, but it's hitting plans really hard right now, and the pharmaceutical companies really have a market on this, and it's something we're watching. Specialty medications are going to end up being about 50% of the cost of pharmacy over the next 10 years. So we're following this. Cigna is doing prior authorizations on this to manage those people, make sure it is appropriate use and that the drugs do not go to waste and things of that nature. And then finally, page 6, a quick review of dental. Very similar to the pharmacy. In the top right, you had about the same growth on the dental, about 4 to 6% on employees and membership growth in the dental. As you move down the page, due to a lot of recruiting that we've done in the dental networks, your employees and members actually increased their in-network utilization of participating contracted dentists up from 80% up to 84%, well above what we see on our book of business. And so that's driving a lot of the costs down because we're getting those contracted discounts every time they see an in-network dentist. Overall, we had about $1.2 million in total discounts, which was about a 16% trend over the previous year, so a very good result there. And as you move to the bottom of the page, just so you know, year-over-year trend on dental was moving right according to what our book of business would say, which is about 7.5% trend on a per member per month basis. So doing a lot of good things there. I think over the years, as we get more and more people utilizing in-network dentists, that trend will remain flat, and it's giving a good benefit to people. So that is, just like I said, a quick review of your products with Cigna and some highlights that we noticed. Are there any questions that I can help answer?
Anyone have any questions? All right then, thank you. That is a good, concise, understandable report. Thank you. Okay, Mrs. Street, announcements.
I wanted to provide just a reminder about Zency. If Miss Perrin looked a little tired when she came up, it's because she probably is. She's worked very hard helping people over the last month. That's come into her office, phone calls we've received on Zency. November the 30th is the deadline for that. We received a report this morning from Cigna that dates to the 8th of this month. We were at 64% completion based on that report. We have gone out and visited every school. We spent some time at the sheriff's office. We've been to the highway department. We've had meetings here doing education about the program, how to complete it. We've done lots of one-on-ones in our office to assist people. The national average is around 50%. We would have hoped to see more by this time, but the reporting is about a 10-day delay, so this is not the final number for completion. But we did want to provide that final reminder here, and we will do one more email reminder out to employees to let them know as well about the November deadline. I'm sure that they have gotten used to seeing those emails. I think when I counted last, we were around 10 emails that we've sent out, just trying to encourage people to, give them information and make them successful and serve as reminders. as well.
Anyone have any comments or questions on the Zinsi report? Keep on encouraging everyone to get that completed. Other announcements? Ms. Harvey?
Have a breakdown of, is it the Board of Education versus, the other county employees of what percentage has been completed? Do we have that type of information?
We don't. All the reporting that we receive is aggregated reporting.
Any other comments or questions? All right, is there any other business? We do not have a meeting scheduled for December, is that correct?
Correct, sir, because of the holiday.
So, happy holidays, and we'll see you sometime in January. We are adjourned. Thank you very much.